Most people know that using tobacco causes cancer and lung disease. But evidence shows many people aren't aware that tobacco also causes heart disease and stroke, the world's leading killers. On World No Tobacco Day, WHO is shedding light on the harm that tobacco inflicts on human hearts all over the planet. Tobacco kills more than 7 million people each year. About 3 million of those deaths are from heart disease and stroke. It should not be that way because we know what to do to prevent it. Banning smoking in public places and ensuring there is no marketing or promotion of tobacco products protects people from this hazardous product. Raising taxes and prices to make tobacco products more expensive reduces consumption, can generate revenues for health systems, and reduces the suffering and death caused by heart disease. Stopping the illegal trade of tobacco will ensure these deadly products are not available easily or at cheap price, especially to youth. Many of these steps and others are being implemented in many countries because they work and cost little to implement. We need to see more of this. Governments have a responsibility to make their communities safe and to help people attain the highest standard of health. Health and tobacco cannot coexist. Don't let tobacco break your heart. Choose health. Thank you.
With that statement from the Secretary General of the World Health Organization, evidently there's no better time to start having the conversation than now. As it turns out, I'm joined by two gentlemen, both of them doctors. From my immediate left, I have Dr. Olani Ayilara. He's from the Federal Neuropsychiatric Hospital based here in Benin City. He has a background in drug addiction. Yes, we appreciate your presence on the program. And next to Dr. Ayilara is somebody from University of Benin Teaching Hospital, of course, here in Benin City, Dr. Frank Okachi, preventive dentist. It's a pleasure to have you in the program as well.
Thank you.
Let's have the conversation, gentlemen. First off, behind camera, you and I had a small talk about the complexity, as it were, of addiction. You want to give us a perspective on that?
Well, addiction is taken sometimes in social parlance, but in medical terms, we use dependence.
Okay.
And dependence, you have a set of criteria, about 6 of them, to which when someone has 3 or more, then the person is said to be dependent on a substance or addicted to a substance. In this particular case, we're talking about tobacco. The first thing is that there is a strong desire, urge, or craving to use. The person is always thinking about the drug and how to use it. The second criteria is that there's difficulty in initiating, in stopping. You can use it in appropriate places. You have lost control over where to use it, when to use it, or how much to use. Then the third thing is the tolerance. You started probably with 4 sticks, 10 sticks, now you're on 60 sticks a day. That's tolerance. And then there's withdrawal. When you're not able to smoke, then you now have all this array of withdrawal symptoms, which we'll still talk about later, tremors, agitation, inability to sleep, aggression, and sometimes even depression.
You mentioned sticks in your narrative.
Yes.
That's, for whatever it's worth, leaves the impression that tobacco, as it were, is limited to cigarettes. Is there any truth in that?
Not really. Tobacco use, you have many ways of using tobacco. Initially, it was chewed. Before people now felt, okay, they want a way to deliver it faster to the brain. And so it's easier with smoking.
Okay.
But apart from chewing, people also use it as snuff. And the one that is not common around there is what they call dipping, that you put between the gum and the lips, and for easier assimilation over time. And there's another one, snuff, but they're not common around there. But commonly around there, people smoke, and people don't do more of chewing any longer. So, but predominantly people will not.
Doctor, can you tell me something about health implications now? I mean, you're not a stranger to substance use and abuse. That distinction is difficult because obviously there's a blur between use and abuse. At what point do we know what the difference is between both?
Okay, in terms of use and abuse, when the distinction comes into play, when you are looking at use and abuse, when you use any substance beyond the medically recommended dose, that becomes abuse. You use that just to your discretion without any advice whatsoever. That's where abuse comes in. And in case of tobacco, it is really being abused because medical advice world over, we are always advised to refrain from tobacco and any other related forms of use. And when you go against such decisions in terms of tobacco use, that is termed tobacco abuse.
Over time, we've been told that people who use tobacco derive pleasure from it. That's an element of reality we can't pretend about.
Okay.
However, we are also told not to be ignorant of the consequences of tobacco use over time. Now, in the middle of this kind of conversation, the factor of ignorance is there, and then you have the element of poverty as well. How do we begin to mitigate all of these issues towards ensuring that we minimize abuse of tobacco and drugs over time generally?
Yes, when we look at tobacco abuse per se, talking about the health implications, it's more than that, because these days now, there are other factors that determine your health state, aside your present state of health itself. And tobacco has been known to cause adverse effects beyond health. There are environmental effects, social effects, economic effects, and this in its own tends to affect health indirectly. So that's why we call them determinants of health in a way. And when you look at the issue of tobacco in terms of its health implications, if you understand the mechanism in which it brings about these effects, it's really easy. Okay, tobacco on its own leaves the main substance causing the addiction is nicotine. Nicotine, as we know, has a way of stimulating our brain receptors, giving us this sense of pleasure. So I want to break it down as simple as possible. Then aside that, it has other residues that gets to be deposited in blood vessels, in our systems. So these over time cause irritation, makes the body react in a way it's not supposed to all these things. And also the gas aspects, especially the carbon monoxide, it reduces the ability for you to be able to utilize oxygen that you breathe in the body. So it's a serious problem. Aside that, when you look at the economic and environmental effects, producing tobacco really has detrimental effects in the environment. Leads to deforestation, the chemicals being used in this production and all that, and the use end product being left after, let's say you smoke, the cigarette butts and all that. These have damaging effects in the environment. It has been reported that nearly 1 billion people smoke in the world, and imagine 1 billion chimney releasing gaseous smoke in the atmosphere. It has been implicated for the significant climatic changes that we experience. So when you look at all this, looking at the health issue per se, we are limited. When we are discussing tobacco and its effect, it should also extend to all these aspects which I've just mentioned, in terms of economic cost of treatment and all that, loss of productivity. Tobacco is a serious public
Now,
health
talking about
disaster.
how serious it is, I mean, for this year, for example, the World Health Organization is saying there's a correlation between the use of tobacco and cardiovascular health. How timely is that?
Well, it is, because when you look at cardiovascular disease, it's the leading cause of death worldwide. And whether we like it or not, nearly 18 million people die annually from cardiovascular disease. And the thing is, it's not as sudden like some infectious disease that we have that will make headlines, like Ebola and all that. It's a silent killer. Comes gradually, eliminates the individual system by system, shutting down the system. So it is timely, because cardiovascular disease, in terms of the leading mortality it commands, Also, it's a pity that people die from cardiovascular disease because it's easily preventable. Simple lifestyle modification, healthy living would reduce the mortality figures. So that is why it is time that...
Let me turn to you now, Dr. Ayulara. You are a stakeholder, apparently. In the last couple of years, the WHO has made frantic efforts to ensure that we turn the trend around for the better. Would you say, in your candid opinion, assessment, that we have seen much of difference being made on that front? Because every year there's a new focus, but still staying with the narrative of tobacco and its abuse. Have we made a lot of difference so far?
In terms of the difference, I don't think we've made so much difference. And because there's so much money in tobacco.
It's a big industry, isn't it?
It's a big industry.
Yeah.
So it's difficult. You know, we can talk about cannabis, we can talk about cocaine, and you prescribe, and then you make it illegal to possess and to move. But with tobacco, it's still there. It's a social drug. It is something just like alcohol that people can use. So until you face the reality that is as dangerous, equally dangerous, or more dangerous than the other drugs, then we're not going to make so much progress. Even in the treatment plans, you know, you look at whether, well, if someone is still using all drugs, he has stopped all drugs, but he's still smoking, then he's still said to be abstinent. When you come up with things like that, it's going to be difficult, and the problems are there. WHO came up in 2004 report of that 5.4 million deaths attributable to smoking. And really, nothing has been done regards this. Yes, you know, they make them write the warning labels. They make them do all.
And that warning has evolved over time.
But people really will not. Once you are taking your cigarette, you're taking your cigar, you're not looking at any warning. You're actually looking forward to the fun, the pleasure of having.
There's something the WHO has done over the course of time. That is to try to drag the governments across the world into this fight against the use of tobacco. Is that realistic? Looking at the fact that governments make money through taxes from the sales of tobacco, is that realistic now?
You see, it's not really a ban on sale. It's really, okay, age limits. You put age limits, and then you say, okay, don't smoke in public. And you know, you have even in some companies designated areas where you can smoke and everything. But it doesn't really deter the people who want to smoke.
Let's talk about the e-cigarettes now. That's becoming kind of popular, maybe not so much around here. Is that supposed to be a shift from the norm, make people stay away from tobacco generally?
The major problem with tobacco is that it's smoked, and most users smoke, and the smoke, just as the other person has talked about, all the problems arising from that smoke. So the concept of e-cigarette is to vaporize it, to make it aerosols. So it's not like smoke that is, you know, not people like second-hand users, as in people who are around and you're smoking, because it's not only detrimental to the person smoking, but people around, and then who are so inhale the polluted air. But with e-cigarette, it's like a vapor. But at the same time, when you see someone using it, it's like it's smoking. But at that time, it's not smoke, it's just aerosols. But it also has inherent problems over time. Just like nicotine can be addictive. So that's another way to look at it. It may not have all those problems as cancer, but it also will have.
So in the final analysis, we're saying it's not realistically possible to regulate the use of tobacco. That's the point, isn't it?
People must be ready to face facts and lose money. Governments must realize that they are getting money from tobacco, they are getting money from alcohol, so it's going to be difficult. And even when, you know how politics is, even when you try to do anything in government, these people have enough money to get you out of government too. So we must be realistic.
Dr. Kachi, tell me something now. I mean, Nigeria belongs in the so-called third world category. Does that pose a unique challenge for us?
Yes, it does. Because studies have shown the majority of those who smoke are really from people from low and middle income countries, which Nigeria belongs. And aside that, also studies have shown that many who smoke are engaged in manual labor or are unemployed. These factors characterize our country, Nigeria. So it's really a big problem. Indirectly, what is all these statistics I've just read out now shows that if you look at what we have, majority of our youths do use tobacco and tobacco-related products, and it's a big problem. So, but I think the government is trying, because if you look at it, we have the National Tobacco Act, which was signed into law. That was like in 2015. And if you look at those laws, so many things were there. There is a committee that regulates tobacco's advertisement, promotion, production, and stipulates rules for age use of tobacco, places where they are to be used, regulations involving where they are to be used, defaulting, penalties for all that. But I think the problem lies with, just like my colleague said, enforcement. Because it is obvious. You can just walk across the streets, just meet Mami Winosa, and you get a stick of cigarettes. People send 5-year-olds, 10-year-olds to go and buy a stick of cigarette. Why in the act, you are not allowed to sell a stick of cigarettes? You only sell in packs, and to those who are 18 years and above. But we abuse all these things because the enforcement is lacking. I think that's where we really need to do more in terms of enforcing the National Tobacco Act, because the act itself is really rich, compares favorably with other acts in high-income countries. Yes. So
let's talk about the role of members of the public, because it will appear we can't leave all of these entirely to governments and institutions. What should I be knowing as a citizen, for instance, about the use of tobacco? What is my responsibility to myself?
All right. The responsibility to yourself is that you have a right to stay healthy. All right. And your right stops where the other person's right starts. Smoking or using tobacco and tobacco-related products, you tend to harm yourself. You tend to harm your organs, increases your risk of having health problems, and at the same time, when you smoke, you endanger your loved ones. Okay? Because studies have shown that when you smoke, secondhand smoke, those who are around you inhale it, they are at increased risk of having these health challenges like you do. And you are also responsible, because these habits consume your finances, leads to breakup of relationships. You owe it to yourself, and the environmental impact it has also. So it is your responsibility to ensure that you are responsible for yourself, and you are responsible for the nearby person who most likely would be your loved one.
Let's talk about something along that line too as we begin to wrap up on this conversation. What's your last word as to what we have to do going forward, whether as institutions, as governments, as families, to ensure that people stay healthy? Because it's already been established that you can't live a healthy life when you use tobacco. So going forward, what exactly should we be doing to ensure that we stay with health?
Try and discourage people smoking around you.
Okay.
There are many times you are in public vehicles and the driver is smoking or other people are smoking. That's a confined space. So you might as well be smoking. So you try to dissuade people. And as much as you have, just as we have this video to talk about it, discourage, let people know, oh, that smoke, do you know what it can cause? Yes, he may say, well, it has not done anything. I know somebody who's been smoking for 90 years. But you know,
he has not died.
Softly, we get across. As an institution, it's a no-no. Once you have an institution, you do not come and smoke. Of course, people may try to smoke, especially people who are addicted to it. But at least for most, you can control as an institution, especially government institution. You can enforce ban on use of tobacco. Then, as a government itself, you see, we must look at who are the smokers. They are everywhere. And so you must, even as a matter of urgency, just as we have said, enforcement. But you see, when people who are enforcing are also using and in an irresponsible way, then it becomes a big problem.
So it becomes a matter of he who has to come to equity has to come with clean hands. Because if you smoke, you can't deal with those who smoke too. Incidentally, you are experts in drug addiction. What do we do with those who already are addicted now?
Like I was mentioning earlier, for those who are addicted, is treatment. And a lot is being done by WHO, European Union, and UNODC, United Nations Office on Drugs and Crime, training and then strengthening, in partnership with Federal Ministry of Health, training and equipping many hospitals. But we need to go beyond that, because most of those facilities are in psychiatric hospitals and people are not usually willing to come thinking, oh,
stigma, right?
I don't have
mental issues. I'm not a madman.
I'm not a madman. So, but you know, we could go beyond that. They've tried to do that with NDLEA too. So there's a lot going on presently, because you need to equip the people who treat. But treatment modality will also be inpatient or outpatient, but rehabilitation is usually required.
Gentlemen, thank you for coming on the program. We so appreciate it. I've been talking with two doctors from Benin here. I've been talking with Dr. Olani Ayelara from the Federal Neuropsychiatric Hospital in Benin. He's a specialist in drug addiction. And then over there, his colleague from the University of Benin Teaching Hospital, Dr. Frank Okachi, community preventive dentist. Thank you, gentlemen. We appreciate the fact that you took out time from your busy schedules to be here with us on TMI this Thursday morning.
Do you know tobacco causes over 1 in 10 heart disease deaths, and breathing secondhand smoke causes strokes and heart attacks? No? Well, you are not alone. Hundreds of millions of tobacco users are unaware that tobacco causes heart disease. But now, you do. Protect your heart and choose health, not tobacco.